Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper and lower all wisdom. So upper right wisdom, lower right wisdom, upper left wisdom, and the lower left wisdom. This is the 3D rendering of the patient. Here we can see that the lower right is horizontally impacted, the lower left is vertically impacted, and the upper molar, third molars are distoangular impactions. Now this is the panoramic view. On the panoramic view, we can see that we have a missing central incisor here. We've got the upper wisdom teeth at distoangular. We've got the lower left wisdom tooth, which is impacted within the ramus, where it is straight. And we've got a lower right wisdom tooth, which is horizontally, almost horizontally impacted. Sorry. Now, moving to the transaxial view, we're going to show you each and every tooth individually. On the transaxial view, this is the upper right wisdom tooth. The transaxial view can show you that the tooth is erupted. We have a cavity which is present in the upper right wisdom. It's a class 1 cavity, has not yet touched the nerves. It is not in contact with the pulpons, but in fact is a cavity. Moving to the upper left wisdom tooth, on the upper left wisdom tooth we can see that the upper left wisdom tooth has very significantly curved root. This one also has a class 1 cavity which is much more closer to the pulp chamber, which can be appreciated here. We do see sinusitis present in the upper left maxillary sinus, and the upper right maxillary sinus does not show any sinusitis here. Now moving to the lower right wisdom tooth, the lower right wisdom tooth is present right here. If we can slightly zoom in for our doctor. So this is the lower right wisdom tooth. It is horizontally impacted. As we move distally, which is towards the ramus, you can see that the root portion is completely embedded into the ramus. The orange shows the inferior alveolar nerve and the inferior alveolar nerve canal. Here we can see that the inferior alveolar nerve canal is in contact with the roots of the wisdom teeth. There is very minimal compression, but there definitely is compression seen. There we go. This is the inferior alveolar canal. We can see that there's a kidney bean shaped canal, which means that the teeth are pressing on the nerve. That is why the circular architecture of the inferior alveolar canal can be seen in a bean shaped here. And as we move more medially, that the circular canal comes back, but as we moving distally, we can clearly see that the inferior alveolar nerve is in direct contact with the lower right wisdom tooth nerves. And as we are moving superiorly, the apex is just in contact with the inferior alveolar nerve canal. Now, if we look at this tooth from an axial point of view, this is the axial view. The axial view is actually top to bottom. So this is the lower right to wisdom tooth, horizontally impacted. Here we can see that the nerve is in very close approximation to the apex of the tooth. Here also the canal shows that it is slightly change in architecture, which means that the tooth is in very close contact with the nerve right here. So this is the lower right wisdom tooth. Now moving to the lower left wisdom tooth. On the transaxial view, we can see that the lower left wisdom tooth is close to the inferior alveolar canal, but the inferior alveolar nerve is buccal to the tooth. This tooth is completely embedded. The distal portion of it is completely embedded into the ramus. We can see that the tooth is placed much more lingually, but it is significantly away from the inferior alveolar nerve, and in no position that we can see that this tooth is in contact with the inferior alveolar nerve canal and on the CBCT. On the axial view, we can see that this is the inferior alveolar nerve. The inferior alveolar nerve comes close to the tooth, but it is very much buccal to the lower left wisdom tooth. And here you can see that the nerve is quite far away and should not be a problem while the extraction of the lower left wisdom tooth is taking place. So these are all the 4 wisdom teeth. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.